Hi, Assalamualaikum. Today I will talk about seizure disorders and epilepsy. Okay, what is epilepsy? Epilepsy is a chronic neurological condition of recurrent seizures that occur with or without the presence of other brain abnormalities. Okay, what is seizure? Seizure may be defined as a temporary involuntary change of unconscious behavior, motor activity, sensation, or automatic functioning. Okay, now about provoked seizures. Actually, they have three provoked seizures. Occur frequently in children as a result of fever, acute illness, or CNS infection, or after traumatic brain injury. Also, they have two major types of seizure. The first one is generalized seizure. It means which involve the entire cerebral cortex. And the second one is partial seizures, which begin in a single location and remain limited or spread to become more generalized. Okay, now I will talk about type of generalized seizure. Actually, they have 5 types. The first one is tonic-clonic, and the second one is absence. The third one is atypical absence, and the fourth one is myoclonic, and the fifth one and the last one is atonic form. Okay, now is tonic-clonic seizure is actually occurs most frequently and common have an aura or sensation is about to begin loss of consciousness, and the seizure also may last 5 minutes and may last 1 to 2 hours, which in this sleep. Absence seizure actually characterized by a momentary loss of awareness and the absence of motor activity except eye blinking or rolling. And then this is usually less than 30 seconds and no protracted period of seizure. And myoclonic seizure actually consists of contraction by single muscle, and then akinetic seizure is about primary problem is a loss of muscle tone among children when they are not so tough to do activity in their life. Okay, now about partial seizures. Actually, partial seizures either simple or complex, and actually is common type in childhood, and approximately is around 60% of cases, and it may experience both generalized and partial seizures, that which is called mixed seizures disorders. And we also will talk about the complex partial seizures was originate in the temporal lobe. Automatic reactions, confused and disorganized in their activity, and they may have sensory experience, and the children hearing sound of various types. It's about simple partial seizures. Actually they involve the motor cortex and then result in clonic activity of the face, and the physical symptoms such as hallucinations, illusions, auditory hallucination or olfactory sensations. And the infantile spasms also was serious street development, and it was begin at 6 months and disappear when 24 months among children, and it will be effect in development appears to stop and skill may have lost. Okay, and now I will explain about the incidence and prevalence of seizures that actually is difficult to estimate, but the incidence generalized seizures and including tonic-clonic, absence and myoclonic seizures is 2.5 per 1,000 children, and the incidence partial report to be 1.7 to 3.6 per 1,000 children, and the unclassified and mid seizure is 2 per 1,000. Anticonvulsive medication actually is administered in attempt to control the seizures, and actually like medications also, they have a common side effects such as cataract, weight gain, high blood pressure, drowsiness, liver damage, hyperactivity, gum enlargement, and anorexia, lymphoma-like syndrome, hair loss, organ, pathologic fracture, and vomiting. Now is about surgical intervention. Actually, it's used if control of the seizures cannot be achieved with medication, and to cure epilepsy shown to be effective by reducing the seizures focus of brain. We have the terms hemispherectomy, means remove of more one side of the brain, and is used for seizures that arise from multiple faults in one side of the brain, and is the progressive unilateral disorder. Okay, now is about emergency treatment of seizures. Actually, they have 7 steps. The first one is remain calm, and the second one is time seizure episode, and the third one is protect child during seizure from anything that dangerous, and then the fourth one is when seizure stop, we must take the time to look how long the seizure is happen. And the fifth one is check around mouth for evidence if anything inside children's mouth. And the sixth one is remain with child to observe if the child or children is still breathing. And the seventh one and the last one is seek help if the child is not breathing, and follow the security to make sure the child is still okay. Okay, now we talk about conclusion of seizure disorder and epilepsy. Actually, the research shown that 50% to 75% of children can achieve complete seizure control with medications. Okay, that's all what I was share, and then I hope that it will give a guidance to you all to follow and know about this topic. Okay, thank you.